In your records, Mr. Perkins has gone over a number of post-operative visits with you.
You may.
Just for your reference,
Okay.
showing you a calendar.
For the record, this is a April 2007
Yes,
calendar.
April 2007 calendar. And in fact, may I mark it, Your Honor?
I think it would be helpful maybe to many people.
The calendar has been marked as Defendant's Exhibit A. Your Honor, we'd move for it to be received.
Any objection?
No objection.
A is received. Defendant's A is received.
In your records, you indicate that that you saw Michelle on April 8th of 2007.
Right.
And as I read the calendar, April 8th was Easter Sunday.
Mm-hmm.
Do you believe that you were in your office on Easter Sunday?
I know I was.
You were?
Mm-hmm.
And what time of day would you have?
It would have been in the morning, probably late morning.
Okay. I was just curious. That seemed odd to me.
I try to be consistent.
All right. In relation to the medications, you've indicated that that you gave instructions about how the medication should be taken,
Mm-hmm.
correct?
Yes.
And the instructions that you gave were, quote, just to take them only as indicated, take one pill and assess the effect after a half hour or so. And if you need another of something else, then take it. But don't take all of them together, certainly, or anything like that.
Okay.
Is that a fair statement
Yeah.
of your instructions?
Mm-hmm.
And those are the instructions that you gave to Martin and Michelle when you gave the prescriptions on April 1st?
Most likely something similar to that.
And Phenergan, Valium, Percocet, and Ambien can be taken safely together, correct?
They can be taken safely, but probably not simultaneously.
And so when you gave the instructions about taking the medication, you told Martin and Michelle to follow the directions on the prescription.
Right.
Correct? And so would you turn in your notes to the prescriptions
Sure.
that you gave on April 1st?
Okay.
And so in relation to Valium, you prescribed 5 milligrams of Valium, right?
Uh-huh.
And in the prescription note says 1-POQ6 PRN anxiety.
Right.
Fair to say that that's one pill by mouth every 6 hours as needed for anxiety?
Correct.
And then in relation to Phenergan, you prescribed 25 milligrams, correct?
Right.
And you put 1 PR. That stands for per rectal,
Correct.
right? Instead of like PO, which per oral, is that what the O
Right.
stands for?
Right.
Okay. So 1 PR every 6 hours as needed for, and use up nausea,
Nausea, vomiting. Yeah.
nausea, vomiting, okay. And then Percocet, you prescribed 1 to 2 PO every 4 hours, correct?
Okay, yeah.
Is that
Yes.
accurate? And then Ambien, you prescribed 10 milligrams, and then you put 1 PO, and yeah, I think I'll need your help on
QHS every
QHS.
evening as needed.
Okay, every evening as needed, okay. Thank you. And so the instructions on the medication indicated that these medications could be taken together with appropriate spacing. Fair to say?
Well, they don't say that they can be taken together. They just say they can be taken for that indication.
And your instructions is to take one pill, assess how you're doing after a half hour or so,
Right.
and then if you
If you still have a symptom or a new symptom, then you can take another one.
Another one,
Yes,
right?
correct.
and
Or a different one, usually not the same one again.
right, okay, and when you perform surgery and people are in the hospital, it's common to give these types of medications, correct?
It is.
And in fact, in the hospital, it's not uncommon to give them all together at the same time, is it?
No, you don't give them together. You space them out according to the symptoms.
Okay, isn't it fair to say that you've testified in the past that in the hospital, they're given together?
Well, if I said they were given simultaneously, I didn't mean that.
May I approach, Your Honor?
You may.
Okay.
So at the preliminary hearing, you said, quote, "They could all be taken together at the same time as long as they were taking an appropriate dose."
That could mean a lot of different things, and what I mean by that is within the same window of time. You don't typically take a bunch of medications all at once. You assess, as you mentioned before, but simultaneously means that one is still on board when you take another one.
And so it hasn't cleared from the blood when you take another one.
Right.
And so then, at the preliminary hearing, I asked you, so please explain to me how would they be appropriately taken together at the same time safely? And you answered, well, as I said before, I would probably try to do just one at a time. That would be my recommendation. But if someone did take them all at the same time, I think they would be okay, because we give those combinations in the hospital post-operatively. That's what you said, isn't it?
Yeah, I mean, like I said, we typically don't give them all at once, but I think you asked me, could you give them all together? And you probably could, but that's not what we typically do.
Well, my question was, would you like to review it again, Mayor?
Just tell me, I can.
So my
I
question
think
was,
I'm sorry, I think, is it the same one you've just done, the same statement you've just done?
there's another part of it.
Okay, go ahead.
So my question was, and so please explain to me how would they be appropriately taken together at the same time? And then we just went through the first part of your answer, and the last part of your answer is, quote, "We give a lot of medications simultaneously, and you know, that's indicated and people are okay. But when people are at home, I have a higher level of caution, and I always tell people, you know, if certain medications have effects that can combine, then I generally tell them to take one at a time."
Okay.
Is that an accurate statement?
Yeah, but like I said, whatever I said, they're not typically administered at exactly the same time. You give one medication and then assess, and that's whether it's in the hospital or not.
Sure. Your opinion was that if there's, even if one of the Percocet, the Valium, and the Ambien, and the Phenergan, even if they were taken together, one pill of each,
Right.
you didn't think that
I thought that would be okay.
yeah, you didn't think that would.
I don't think that would result in someone's, becoming hypoxic or stopping to breathe. But
And that's based upon your experience.
yes, and every patient's different again, you know.
Of course.
If it's someone that's doesn't have a lot of body weight, then that may be different.
Michelle was 180 pounds.
She was kind of an average adult, yeah.
In fact, in Michelle's case, the medications that you ordered for her to be administered in the hospital included morphine, Vicodin, which is Lortab,
Right.
hydrocodone,
Right.
Tylenol,
Right.
Ambien, and Zofran.
Right.
Zofran's a different type of anti-nausea.
Correct.
And so you expected that the medications that you ordered in the hospital could safely be administered to Michelle in the hospital.
Right. Under a nurse's supervision.
Of course. You didn't expect that they would cause death, did you?
Correct.
And those are similar medications to the medications that you prescribed to Michelle.
They are.
And even the normal medications that you prescribe, the hydrocodone and Ambien and Phenergan sometimes, they're dangerous medications, right?
They can be.
They can be, and if not taken appropriately, they can have bad consequences.
Definitely.
When medications are taken pursuant to your instructions to take one and then wait and determine a half hour or so and determine if symptoms persist and you need to take another one, the medications don't immediately clear from the system whether your liver is working well or not.
Correct.
Pretty common for medications to remain in your system 1 to even a few days, right?
Yeah, it just depends, but yeah, they take several hours to clear.
And so if somebody is taking these medications appropriately, following your instructions, and at any given time their blood is drawn, it wouldn't be surprising to you to find levels of each medication in that blood. Fair statement?
Right, except that I don't know the clearing times of all the medications, and I think they are different from one to the next.
Yeah. If somebody's taking them all during a period of time, though, it wouldn't surprise you to find all of the medications in.
Objection,
in the
asked and answered in foundation.
Overruled as to foundation, sustained, asked and answered.
In relation to the Lortab that was prescribed in liquid form, the liquid form has the exact same medicinal components as the pill form.
Yes.
Correct? And when Martin asked to have the liquid form of Lortab, the discussion that you and he had was so that there would be an option to have both a pill form or a liquid form of pain medication.
Right.
Right? So that if Michelle was struggling to swallow, there would be an option.
Right.
And the Phenergan was requested in a suppository for similar reasons.
Right.
To help with nausea through an administration route that wouldn't require necessarily to go through the mouth.
Yeah, it probably wasn't requested as a suppository, but that's what I prescribed.
That's what you prescribed.
Right.
Okay. Regarding the metabolization of medications in the liver, you don't know whether or not there were any liver complications after the surgery, do you?
What do you mean by that?
You don't know whether there was any developing liver problems after the surgery.
No.
That's all the questions I have.
Thank you, Mr. Spencer. Does the state have redirect?
Yes, please, Your Honor.
Go ahead.
First, I'd like to ask you about your interactions with law enforcement in this case.
Okay,
Have you met with investigators about Michelle's death?
I have, yeah.
And have you met with prosecutors?
Yes,
What was your understanding of the purpose of those meetings?
to gather information.
Has anyone instructed you on what to say?
No,
Has anyone tried to influence you about what you should say regarding Michelle?
no.
What did you do, if anything, to refresh your memory for testimony today?
I didn't do anything. I just, actually, I did look through the chart last night, and, but that was it.
Okay. What did Martin tell you Michelle was taking when it came to medication before her death?
According to my records, it was 1 to 2 Percocet per day.
Mr. Spencer asked you some questions about theoretical possibilities of when medications could be taken.
Right.
I'd like to discuss with you what was actually happening with Michelle. To your knowledge, was she taking all those medications?
Objection, Your Honor. Foundation.
Sustained as to at a point in time.
Did she report to you during their post-operative visits about her consumption of medication?
That I just don't remember, and if I've given previous statement, that would probably be better than what I have right now.
Okay.
You may.
Let me ask you this. When you visited with her in those post-operative visits, did she report to you any of the symptoms that would require these drugs?
I don't recall her reporting any of those symptoms.
What was your understanding of her use of those medications?
That it was becoming less and less.
And that's based on
My notes and the visit that we had.
what was the indicated use of Ambien?
For sleep.
And what were your instructions about taking that medication?
To take it in the evening.
Is there any medical reason for her to take it in the morning?
No.
Okay. I'd like to talk about overlapping effects a little bit more. If I have pain and anxiety, and I take a medication for one or the other, let's say I take it for pain, what happens to my anxiety?
It very likely will be reduced with the pain medication.
So if I were assessing half hour, hour later, what would you say about my need for the anti-anxiety?
It could be,
Your Honor, foundation and an incomplete hypothetical.
I'll withdraw, Your Honor.
Sustained, I think it's speculative. Go ahead.
Okay. When it comes to driving, to your knowledge, have patients driven within the 1 to 2 weeks after surgery despite your recommendation?
yes,
Do you know whether Michelle was driving or not?
I don't.
If a patient of yours were taking all 4 of those medications that we've been discussing, how would you expect them to present?
Objection, Your Honor, foundation.
Well, how's foundation lacking?
Because we don't know how much they're taking, when.
I'll
Sustained.
refine the question if I could.
Sustained. Go ahead.
The medications that you prescribed and the dosages that you prescribed, if Michelle had taken all of those, what would you expect to see in her?
Same objection.
Sustained.
Okay. How did Michelle present to you at her postoperative visits?
She was awake, alert, and behaving appropriately.
Was it consistent with profound central nervous system depression?
No.
Okay, that's all I have.
Thank you. Do you have any additional questioning?
No, Your Honor.
Dr. Thompson, thank you. You may step down. May Dr. Thompson be released from his subpoena? Thank you. Periodically during the next 5 weeks, you will find I forget that. And so if you would raise your hand, if you have questions, that will help remind me, or someone can just say, Judge, what about questions? And that will help me remember. Do you have any questions for Dr. Thompson? If you'll raise your hand. Okay, if you'll write it down on a piece of paper, please, and the bailiff will collect it. Counsel, would you approach the bench? I have 2 questions for you from the jury, Dr. Thompson. The first is, did it concern you that Martin was acting as the primary care physician for Michelle?
Yeah, I thought that was a little bit unusual.
And secondly, did you raise any objections or concerns with Martin and Michelle about that?
No, and also he'd consulted with another physician, so that kind of made me feel a little bit better.
Okay. Do you have follow-up questions from the state?
No, Your Honor.
From the defense?
No.
Very good. You may step down. Thank you. May Dr. Thompson be released from his trial subpoena.
Your Honor, we may want to call him for rebuttal, but we don't anticipate doing so right now.
Okay. You'll remain under your subpoena, but you'll be contacted if you're needed again. Thank you. You may call your next witness.
State calls Vaughn Welch.
I'll see if it works. Are you Dr. Welch? Where's Dr. Welch? Thank you. If you'll come right up here to the clerk's desk. Face the clerk here. Please raise your right hand, sir, and take an oath.
You do solemnly swear the testimony you shall give in the case now pending before the court will be the truth, the whole truth, and nothing but the truth, so help you God.
Thank you. Would you be seated here, please, and respond to counsel's questions?
Good afternoon. Would you please state and spell your name for the record?
Vaughn, V-O-N, Welch, W-E-L-C-H.
And how are you employed?
I'm a physician at an Intermountain Clinic
Where at?
in American Fork, Utah.
And how were you employed in March of 2007?
As an internal medicine physician.
Okay. What kind of training and education do you have to make you a doctor of internal medicine?
I completed medical school at the University of Utah, and I completed a residency in internal medicine at UCLA in California.
Are you a licensed physician in the state of Utah?
Yes.
And for how long have you been a licensed physician?
It's been about 21 years.
Are you licensed in any other states?
No.
Have you been?
I was licensed in California.
Have you ever been sanctioned or disciplined by the Department of Professional Licensing or any similar agency?
No.
Based on your experience and your training, do you have the ability to assess general health and wellness?
Yes.
On March 29th of 2007, did you perform an examination of Michelle MacNeill?
Yes, I did.
And why did you perform that exam?
I had been requested by her husband to perform a preoperative exam,
And who is her husband? Or who was her husband?
Martin MacNeill.
Is that person in court today?
Yes.
Could
He's
you
right
point
over
him
here.
out for us? Could you point out who he
Yes.
is?
It's the gentleman right here on the front table.
Do you stipulate to identification? Do you stipulate to identification? Thank you.
And so he called you to perform an examination of Michelle.
That's correct.
Did he tell you why he needed Michelle to be examined?
She was preparing for surgery and needed a preoperative clearance before that surgery.
Okay, and so because he called you, did the two of you have any kind of relationship prior to him calling you?
Yes, we worked together. He was the director of the developmental center in American Fork, and patients from there would be admitted to American Fork Hospital, and I would take care of those patients while they were in the hospital. He would take care of them while they were in the center.
So you were associated through your professional capacities. What were your impressions of him as a professional?
Objection, Your Honor, relevance?
Counsel, will you approach? Do you withdraw the question? Thank you.
In working with the defendant in a professional capacity, did he impress you in any way as a physician?
There were things that I liked and things that I didn't like.
Let's focus on the things you liked.
I liked his focus on reducing medications when they weren't necessary. Many of the clients in that facility before he was the director were, in my opinion, over-medicated, and he was willing to back off on the medicine so they'd be a little more awake.
This exam you performed on Michelle MacNeill on March 29th of 2007. What kind of an exam was this?
It was, again, she was a new patient to me, and my focus was on understanding her medical history and giving a report or finding out if it was safe for her to proceed with surgery.
I recognize this examination took place a while ago. Do you remember it?
Yes.
Did you make notes of any kind or have records or anything that could help refresh your recollection of that?
There are records in her medical chart.
And have you reviewed those?
Yeah. Not recently, but I think the court has those.
Okay. Did you perform any kind of labs or other medical metrics when you met with her?
Yes, we performed an EKG, electrocardiogram, and we performed blood tests.
Okay. What can you tell us about this examination?
Both the patient and the defendant were there at the beginning of the examination. We reviewed her medical history, reviewed her symptoms, reviewed systems. We talked briefly about the surgery that she was preparing for. We talked about I performed an examination of her body systems. We talked about the fact that she had high blood pressure and that it would be ideal to have that controlled before she went under surgery.
How did you determine there was high blood pressure?
Well, we took a reading in the office and it read high, and the patient or her husband at that time reported some previous readings that were also high.
Okay. I'm going to ask you to do me a favor. Would you mind pulling that mic a little bit closer to you? Thank you. And so this was a physical to assess Michelle's general health in preparation for a surgery.
That's correct.
What was your understanding about the type of surgery that this was?
The only thing that I knew was that it was cosmetic surgery.
What was your assessment of her health?
She was in excellent health with 2 exceptions. She had elevated blood pressure and she had depression.
Okay. Now you mentioned that at the appointment it was yourself, the defendant, and Michelle. Did it continue to be the 3 of you throughout the entire examination?
During the course of the examination, I asked the defendant to leave the examining room because he was answering all of the questions for her, and I felt like she could speak more freely if he was out of the room.
And did that in fact happen?
Yes.
Did you talk to her then to assess her health?
Yes.
And what did she tell you?
She just said that she was very depressed and stressed and had a lot of symptoms that were related to that stress, but she did not provide details.
Did you offer any treatment options?
I did.
What were those?
I recommended that she start on sertraline, which is an antidepressant.
Is there another name for this drug?
Zoloft.
Okay. Any other recommended treatment options?
I recommended that she start treatment for the high blood pressure with a medicine, lisinopril hydrochlorothiazide.
Anything else?
I recommended that she put off surgery until the blood pressure was controlled and that she report her blood pressures a week after starting treatment.
Now you mentioned that
I'm sorry, and that she do what?
I wanted her to report her blood pressure results a week after starting the medicine.
Thank you.
And why would you want a second report of the blood pressure?
I wanted to make sure that the medicine was effective but not too strong.
And when it comes to diagnosing high blood pressure, what kind of a process is that?
To make the diagnosis, you need a couple of readings at different times in a relaxed environment with the patient at rest.
Okay. You mentioned that you performed an EKG.
That's correct.
And why did you do that?
She gave a history of heart palpitations in the past, and just as a precaution to see the health of her heart.
And you performed that yourself?
Yes.
And did you interpret that test yourself?
Yes.
And how did you feel about that test?
The test showed that her heart was in the normal sinus rhythm without any irregularities, and that there was no evidence of heart disease.
Was the high blood pressure the type of thing that would make it so that the surgery would have to be postponed?
Depends on how high the blood pressure is and the point of view of the anesthesiologist and the surgeon.
In Michelle's case, what did you think?
I think that her blood pressure was in the neighborhood of 160/110, and I think there's a chance they would have canceled it.
Were you worried about long-term risk?
Yes.
Did the EKG cause you any concerns?
No, it was reassuring that it was normal.
Can you tell us about how Michelle was when you were trying to get her to talk about her health and wellness?
She was quiet. She didn't have very much to say. She would answer a question and then be quiet. It was very difficult to get much history or information from her.
Had you been told whether or not the surgery had been scheduled yet?
My recollection is that there was an urgency or an impending surgery and that this needed to be done quickly, but I wasn't aware if a date had been set.
And so you said you offered a recommendation as it came to the surgery, is that correct?
Right. I recommended that she put it off until the blood pressure was controlled.
And who specifically did you tell that recommendation to?
I told it to both the patient and the defendant.
What was the defendant's attitude about postponing the surgery?
He seemed disappointed, but seemed to agree with it.
What was the defendant like during this examination?
The defendant,
Your Honor, vague and speculative?
You're referring to demeanor,
Yes.
if you'll rephrase.
What was the defendant's demeanor like during this examination?
the defendant was anxious that we complete the evaluation and that she could proceed with surgery without having a delay. He was a little bit animated, a little bit excited, to try and get things going. And then at the point where I suggested they wait, then there was a little bit of disappointment.
Did this feel abnormal to you?
A little bit, yeah.
Did you later hear of Michelle MacNeill dying?
Yes.
What were your thoughts about hearing of her death?
I was called by the emergency room physician the day that she passed away, and I was shocked
Why were you shocked?
because at the time that I'd examined her, she was healthy, and it was just unexpected to hear that she'd have a bad outcome from surgery.
Were you surprised that the surgery went forward?
Yes.
Thank you, Dr. Welch.
Do you have cross?
Yes.
Go ahead.
Dr. Welch, fair to say that Martin was frequently animated in your associations with him?
Yes.
And you have provided testimony before at the preliminary hearing in this case, right?
That's correct.
And prior to that, you had an interview with investigators Whitney and Robinson,
Correct.
right? And that was on June 15th of 2010,
Probably.
all right? And then the preliminary hearing was last October of 2012,
Sounds reasonable.
all right? Okay. And you gave your best recollections of what occurred in both of those prior opportunities to testify about this circumstance as well. Fair statement? Okay. And in the interview that you had in 2010, in June of 2010, obviously that was closer in time to the examination that you had with Michelle, right?
That's yes. Was that yes?
Yes.
Yeah, thank you. Go ahead.
And closer in time from today.
Yes.
And when you met with the investigators, you told them that you believed that you had seen Michelle twice. Do you remember that?
I don't remember that particular conversation.
Your Honor, may I approach?
You may refresh his recollection.
Or did it say twice?
Can your co-counsel help, and we'll move on?
We've got one spot and there's one other one.
So would you like me to respond?
Does that refresh your recollection at all about what you said with the interview with Mr. Whitney and Mr.
Yes,
Robinson?
it refreshes my recollection.
Okay. And did you indicate to them that you thought that you had seen Michelle twice?
There was a question as to whether I had seen her once or twice, and I was not able to resolve that during our conversation.
And when you looked at your records, you only had records for one meeting.
Right.
Is that correct?
But I think I know why I had the recollection of a possible second event, and that's that when our labs and information come back, then we rethink about the patient, and in her case, her labs came back after her visit, and so I sent her a message after the visit, giving her instructions and information.
And when you were talking with investigators Whitney and investigator Robinson, you told them that the reason you had a recollection of meeting with her twice is because she may have called back and said, "This is what my blood pressure is surgery okay?"
I don't know what I was thinking then. I just know that I think that the possibility of that recollection came from the responding to the lab results.
Fair to say that you advise all of your blood pressure patients to monitor their own blood pressure?
Yeah, if they're adults and they're able to do it.
And that's what you told investigators Whitney and Robinson, that you recommend, or I advise all my blood pressure patients to have their own monitor and to measure it.
That's correct.
Is that correct? And fair to say that you told investigators Whitney and Robinson that yeah, I think she had a date for surgery and everything. I think we just wanted to look at the blood pressure issue since she's going forward with it.
I think that's an accurate transcript.
That sounds right to you?
Yeah.
Okay. And then fair to say also that you said, I think that she would have called, and when we talked on the phone, she said, her blood pressure was this, and I would say, okay, go ahead with the surgery, but I don't have any record of that.
Right. I was explaining that my usual approach is that someone would call back and report their blood pressure, and then I would adjust their medications or whatever.
So in the case of Michelle, based upon your recollection in 2010, you believe that she had called in, reported her blood pressure?
No, she didn't ever call in and report her blood pressure. But our usual protocol was for someone to make a change on their medications and then give a report, and then we would make an adjustment if needed.
Okay. In 2010, you told the investigators that you think that she would have called. And we talked on the phone, and she said, this is the blood pressure, and you would say, okay, go ahead with the surgery. Isn't that what you said in 2010?
What I said in 2010 is written on the transcript.
Would you like to see it?
But
no
just to impeach him with it. You don't have to show it to him.
Okay.
I'm not sure what you're trying to ask. You're wondering how much I remember of the second conversation?
All I want is to confirm, in 2010, you told the investigators that you believed that Michelle had called in and said, this is my blood pressure, and you would have said, okay, if it's good, go ahead with the surgery.
In 2010, I thought she might have.
Okay. And you don't have any record?
I don't have any record or specific recollection of it. I'm just, again, as I explained to them, my usual protocol is to follow that procedure.
Okay. And you had a recollection also in 2010 of thinking that you had met with her twice, but you only have records of one meeting, right?
I think my recollection at that time was of having met her once and maybe talked to her on the phone once.
When you asked to speak with Mrs. MacNeill alone during the examination, Mr. MacNeill didn't throw a fit or have any problems with it, did he?
No.
When Investigator Robinson and Whitney met with you, they told you that they were looking at filing charges against Mr. MacNeill, didn't they?
Objection, hearsay.
Is this for effect on the hearer?
Yes.
Overruled.
What's the question again?
When Investigator Robinson and Whitney met with you, they told you that they were going to file charges against Mr. MacNeill, didn't
I
they?
believe so.
And they told you that they were having a real hard time. We're having a heck of a time getting past Dr. Gray, didn't they?
I don't remember that statement.
For what purpose? May.
What is your question?
When you met with Investigators Whitney and Robinson, they told you that they're having a heck of a time getting this past Dr. Gray, didn't they?
Apparently, I don't recollect that aspect of the conversation, but I trust the transcript.
Your Honor, I'm going to move to strike because he didn't ask him if it refreshed his recollection.
Sustained.
In your experience as a physician, it's common for Percocet and Phenergan to be prescribed together. Fair statement?
I've seen them prescribed together at times.
At the preliminary hearing, you indicated that Percocet and Phenergan are prescribed together frequently. Is that correct?
Yes.
And based upon your examination of Michelle MacNeill, you didn't see any contraindications to prescribing those medications, did you?
I don't remember that.
Well, I'm asking you if that's just a fair statement. Based upon your examination of Michelle MacNeill on March 29 of 2007, did you see any contraindications to prescribing Percocet and Phenergan together?
Well, her examination was normal, so she would be treated as anyone else that is normal.
Right?
And those are prescriptions that are used for people that have normal health.
And that's my point. So you didn't see any reason that it would be unwise to prescribe Percocet and Phenergan together based upon your examination of Michelle, correct?
Well, during our examination, there was no question of what medications would be used or what medications would be safe.
I understand that. My question is simply that there was no reason that you saw that would indicate to you that it would have been improper to prescribe Percocet and Phenergan together to Michelle MacNeill in April of 2007.
Again, her health was good. There was no contraindication to using those medications.
You also didn't see any contraindications to the medications of Ambien and Valium either, did you?
Again, at the time of the examination, that question was never brought forth or considered.
I understand. I'm just asking you as a physician. You didn't see any contraindications to her being prescribed Ambien and Valium based upon your knowledge, correct?
I object is outside of the scope, Your Honor.
Overruled, he may answer.
My opinion is these kind of medications carry risk and carry danger, and they should be used carefully. And that there was nothing in my examination of Mrs. MacNeill that would contraindicate the normal use of those medications.
In addition to, do you remember in your meeting with investigators Whitney and Robinson, them talking to you about many allegations that Mr. MacNeill's daughters were making against him?
Yes.
Does that refresh your recollection at all on their discussion with you about Dr. Gray or the Utah State Medical Examiner?
I don't know Dr. Gray.
Do you recall them discussing with you having a difficult time with the Utah State Medical Examiner in relation to their
I
investigation?
remember something about the medical examiner.
Just asking you yes or no. Do you remember them discussing with you having a problem with the Utah State Medical
No.
Examiner? You still remember that? Okay. That's all the questions I have.
Thank you. Do you have redirect for the doctor? Go ahead.
Is it fun to testify here today, Dr. Welch?
No, it's not.
Sounds like the investigators shared some facts with you about their investigation. Did that in any way influence what you remember about your meeting with Michelle MacNeill on March 29th of 2007?
No.
Are you telling the truth today?
Yes.
Thank you.
Do you have questions for Dr. Welch? If you'll write it down and pass them to the end of the row, the bailiff will collect them. Looks like we have some others. Any more? Did I no? Okay. You may. Dr. Welch, what kind of facility was it that Dr. MacNeill worked at, and what were the patients there for?
He worked at the Utah State Developmental Center, which is a facility that takes care of individuals with severe mental handicaps.
Thank you. Do you have follow-up questions
State does not.
from the defense?
In your testimony earlier, you indicated that Mr. MacNeill, you admired Dr. MacNeill because of his stance in decreasing the medications of the patients at the developmental center, correct?
That's correct.
And that was based upon a comparison between his practices and the practice of the prior medical director,
That's correct.
correct? So it was the prior medical director, not Dr. MacNeill, that you thought perhaps had the developmental center patients on too much medication.
Correct.
Okay, thank you.
Anything else?
Just real briefly.
Okay.
And could I stand here for the question?
Yeah, that's
Your Honor?
fine, go ahead.
Was it your opinion that he merely reduced it or that he appropriately balanced it?
It's a very difficult job to balance seizure medications in people that have severe brain injuries. And some physicians take an aggressive approach at eliminating all seizures. Some take an approach of reducing medication. And Mark MacNeill was more towards reducing the medication so the patients were more awake.
Thank you.
May Dr. Welch be released from his trial subpoena?
I wonder if we could treat him the same way as Dr. Thompson unless we contact him. He's
Very good. Dr. Welch, you'll remain under subpoena. If you are needed, you'll be called to come back, but you may step down today.
All right, thank you.
Thank you very much. Should we recess for today then, counsel? Okay. Ladies and gentlemen, thank you for your patience. I've indicated that we would try to conclude at 3 o'clock, and we're close today. We'll now recess for the evening. Please keep in mind my prior instruction to you. Don't form or express an opinion about the case either amongst yourselves or to anyone else. It's your duty not to discuss any subject of the trial among yourselves or with anyone else, including family members and friends that you'll see during the course of the evening. Avoid television, radio, or internet news coverage of the trial, and don't do any research on your own using your computer, electronic devices of some kind, or books, anything else. Have a pleasant evening. We'll reconvene at 8:30 in the morning. Thank you. Please be seated. We are now outside the presence of the jury. Are there any matters that we need to deal with housekeeping before we recess?
I think we just wanted to go take a look at the bathtub, Your Honor. It's on the 4th floor.
Okay.
Visit suffice.
Do we need to make that a matter? Do you need me there, or I would like to see it and see what we're looking at size-wise. And
I don't know that we need it on the record.
okay. Why don't we meet together with counsel? Is it on the 4th floor? Okay. In the other, could you approach?